So as Guava uses that really as the central permission point and allows that sharing to happen widely, but it is widely under the direction of the patient. And so the one thing I was going to say is this is really the way the electronic medical record was intended, perhaps, but in fact, I think this is better in that it allows the patient to have agency in this. So, Guava allows you to be the center of all of your information for your own benefit. I mean, on Guava, you'd be surprised the things that people track. People want to track lots of crazy things, Sometimes we even find people tracking stuff for their pets,
Get the occasional email being like, I'm using this for my lovely furry child.
Oh, that's funny.
But this allows the patient to be in control of what's happening with their medical record, even in the way that they're seeking care.
The other really amazing thing, though, that's happening is because of the massive progress with AI, we've been able to fold that in. And I personally am a believer, AI for the sake of AI isn't worthwhile. I don't care. But AI used intelligently and with a partnership of the humans, component and the relationship part, I think that there's a lot of wonderful things that can happen. One of the ways that we've been doing it is having the AI assistant basically traverse all of these different sources of information and then surfacing the sound bites that are likely going to be relevant for the provider on any given patient. So then the provider can determine, okay, this blood pressure reading or these most recent blood pressure readings make sense because I know that this patient has this particular condition, but also this sleep is looking a little concerning. And so I'm going to intervene and contact this patient. And it also looks like they're overdue for a mammogram. And to your point, there are definitely use cases for providers who are using Guava right now where they have those recurring visits, whether it's every 3 months, every 6 months, every year, barring something exceptional that warrants an earlier intervention. And so Guava is that tool and that conduit of care to really help facilitate that, because it doesn't require the provider to go sifting through information, and instead the information is being served to them pretty much automatically, which is also a huge time saver, and to Kat's point, hopefully provides peace of mind because things are less likely to get missed. And it makes patients feel empowered too, because they actually have access to all of their information, and they also have access to the AI assistant where they can ask questions about what does LDL cholesterol actually mean? What are the common side effects of the medications that I have as active on my list right now? And that's really powerful for a lot of people.
One of the things we didn't note is that we've also really intended this to be economical for both patients and providers alike. The base model that doesn't have as much of the assistant ability or the OCR, that kind of thing for patients, that base model is free, but the premium model, which has got a lot of the features we've been talking about, is still inexpensive. It's $8 a month and it's less.
It's nothing.
Years. Not talking about something that is just really designed for, folks who have a lot of extra dollars in their pocket to spend right now. It's really something that's economical, less than your cable bill for sure.
Oh my gosh. Yeah. Gosh, it's the cost of a coffee, at Starbucks, one of those fancy ones.
Yeah, I mean, $8 a month.
More akin to a coffee or two than it is to any other of your bills, and it's really key. And that same thing for any providers who might listen. We are really committed to making this be something manageable for your practice. So I just want to say that we really are committed to ensuring that the most possible people can actually benefit from this. But as a clinician, one of the things that we worry the most about is that we are going to overlook something, that there will be some signal in our patient, in the information that we have about a patient, and we won't see it. We will overlook it and miss an opportunity to intervene, or maybe not catch something that we intended to catch. And frankly, it wakes providers up at night. Ask any of them. You talked about your friends that are all physicians. Ask them. They wake up at night thinking about, oh my gosh, I forgot to check X, Y, or Z on a particular patient. And one of the things that the AI allows us to do is to ensure that providers aren't going to miss anything, because as Isabel pointed out, it really folds in the entire record looking at it, and it has a highlights section for physicians, and highlights meaning the things that need noticing, right? So they might be great, like, hey, did you notice that your patient has been taking 8,000 steps a day for the past 2 weeks? That's notable and great. So I would say that there are two sides of ways that Guava can help this. One, the rural side, but also the much more urban. So we talk about the rural and being able to reach with telehealth, which is really important. But also the thing is that having this AI assistant, I think, will help providers manage large patient panels as well. Because if you have large patient panel, there's no way you can sift through it all the time and look for the things that you need to worry about. And particularly when those pieces of information come from disparate records, you're just going to miss things. And so having an assistant to be able to help you manage a large patient panel is also of great benefit. And so that's much more, for urban physicians. And frankly, if you have patients who travel a lot, this is really helpful. Frankly, if you have patients,
just for patients, you should use it.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.